Good afternoon, everyone, and thank you for joining us in today's webinar on eye care updates. My name is Anne Wong, and I am with the Illinois Chapter American Academy of Pediatrics. This webinar is brought to you with funding from the Illinois Department of Public Health. Before we begin, I would like to go over a few housekeeping items. Participant phone lines are muted. This webinar is being recorded. If you have any questions for our speaker during the presentation, please enter them into the question box on your control panel for the webinar on the right-hand side of your screen, and Matt will answer them at the end of the presentation. Today we are joined by Matthew Swenny from IDPH. Matthew Swenny graduated from Culver Stockton College with a Bachelor's of Science in Psychology, the University of Illinois with a Master's of Arts in Psychology, and Matthew has his licensed clinical professional counselors and Type 75 educational administrative certification from the state of Illinois. He has worked in the healthcare field since 1997. He started working at Heritage Behavioral Health Center in Decatur, Illinois, as an assessment counselor. Once he completed his second master's degree, he was employed by the Central A&M School District as assistant principal at Cameraire Village, their residential school in Assumption, Illinois. Finally, Matthew was employed at IDPH in October 2009 in the HIV section and recently has moved to the immunization section in November 2013. Please join me in welcoming Matthew Swenny. Okay, Matt, you can begin now.
Okay. Good afternoon. This is Matt Sweeney. I have a short slideshow, and then I'm going to actually go into eye care and show you guys a few things of what we talk about in the slideshow, and then we'll open it up at the end for questions. As Ann said, if you have questions throughout, you can just type it on the side there, and then I can answer them. Maybe I can answer them as we go, as well as at the end of the presentation. These first few slides are a requirement for Department of Public Health. So our vision is that the communities of Illinois will achieve and maintain optimal health and safety. Our mission is to protect the health and wellness of people in Illinois through the prevention, health promotion regulations, and the control of disease and injury. Here's some updates. We were organized in 1877. You guys can read this stuff, but I just have to go through them. IDPH updates. We have a strategic plan that's going to go through 2014 to 2018, where we wanted to develop and expand partnerships, improve data utilization, reduce health disparities, improve regulatory compliance, and then we have the brand, market, and communicate IDPH values. Okay, so now we're getting into the actual presentation. Here are the objectives of this presentation. The first is that providers continue to have inventory issues that we're going to discuss. There are some new functions in eye care. The first one is the patient remind and recall function, and then also who to contact when issues arise. So first we're going to talk about continued inventory issues. Providers, both small and large, continue to experience VSC inventory issues in eye care. The majority of the issues are related to the electronic transmission through your EMR records or electronic medical records. And so the question we get a lot is, how do I, as the provider, recognize potential discrepancies? Who do I contact? And what resources are available in eye care? For inventory issues, there are 4 components when you are using an electronic medical record to transmit data to eye care. There are 4 components of every VSC vaccine that is required for us to, for eye care to deduct that from your inventory. The first one is the vaccine brand name. I need to change this slide, and I said that Tuesday when I gave this presentation up in Chicago. But eye care does recognize generic names. They just do not recognize generic names for VSC vaccines. So if you administer a Gardasil 9 and your EMR sends over HPV unspecified, eye care won't be able to deduct that from your inventory because the brand names don't match. The second component is the lot number. Of course, this must match the lot number that is in eye care exactly. The packing list that comes with the vaccines, as well as the outermost box the vaccines are shipped in, will also match what is in eye care. It's important when you get the vaccines from McKesson that you check to make sure that the lot numbers on the packing list, the box, and eye care all match. And then when you're entering those lot numbers into your EMR, you'll want to make sure that they match exactly what is in eye care, and you want to make especially sure not to have lowercase l's instead of ones or zeros instead of O's. So you want to watch out for those two especially. The third inventory issue or component is the CVX MVX codes. The CVX code is like the groupings of codes have similar CVX codes, and then the MVX is the manufacturer code. These are all available in eye care and have recently been updated. And so I'm going to show you that later when we go into eye care where you can find those. But the CVX MVX code, that identifies the vaccine that you're administering. So Gardasil has its own CVX MVX code, so the brand name Gardasil with this CVX code and MVX code, eye care will then see that as Gardasil. And then the last component is the VFC status of the patient. V02 through V07 are the VFC eligible codes. V02 is the one you'll use most often because that is Medicaid eligible. So the question that we get a lot is, how do I, as the provider, recognize potential discrepancies? The first way is that we recommend that providers check their physical inventory against their eye care VFC inventory at least once a week. We actually recommend twice a week, but we understand due to time constraints, if you can get into eye care at least once a week, that would help. Because if you recognize a discrepancy, and if you're in there once a week, then there's only 1 week or maybe even 1 day of data that needs to be corrected. But if you only go into eye care to check your inventory when you order new vaccines, and you only order once a month or once every other month, now you could have, thousands of shots that you need to correct. And then so when you're in eye care, these are the things that you will recognize as potential discrepancies. First is when you're in eye care, the expired lots with a balance. And you can tell that the lots are expired because the expiration date will be in red instead of black or the kind of orangey yellow color that shows that those vaccines are not yet expired. The second one is lots with a negative balance. Obviously, you cannot administer more vaccines than you originally received from eye care, so that identifies a potential discrepancy with your inventory. The third is lots in the no longer in stock inventory with balances. I'll show you where the no longer in stock is, but on your vaccines page there are 2 views. One is the in stock and the other one is no longer in stock. No longer in stock means that you no longer have any of that vaccine in your physical inventory. And so if a vaccine that is marked as no longer in stock has a balance, that's a potential discrepancy. And then of course the last one is the discrepancy between your physical and eye care VFC inventories. You go into your refrigerator and you count all your vaccines and they don't match what is in eye care, that is a discrepancy. So who do I contact when these issues arise? Do we contact eye care or do we contact the VFC department? If you are having inventory issues, you'll want to contact eye care. If you have questions about vaccines, about orders, about the transmission of orders, the shipping of orders, the reception of orders, lot numbers, potential discrepancies in expiration dates, anything related to the actual physical vaccines, you'll want to contact the VFC department. Eye care, you'll want to contact us if you need help with the application or if you're having inventory discrepancies. We do recommend using the Contact Us button in eye care, and of course choose eye care for eye care questions. Choose VFC Illinois for VFC questions if you are not in the Chicago area. If you are a Chicago VFC provider, you'll want to choose VFC Chicago. And emails will result in the quickest response to your questions. It is our goal every day is to answer every email that we receive that day. So 99% of the time we do answer all of our emails by the end of the day. Our staff is here between 8 a.m. and 5 p.m. Monday through Fridays. So the other question we get often is, are there resources available in eye care to help with potential discrepancies in eye care? And there are. And these are 4 resources in eye care. The first one is the Clinic Immunization Activity Report. If you are manually entering vaccines directly into eye care, this is the report that you'll want to use. I will show this to you in a minute when we get into eye care, but this report will tell you specifically if the shot has or has not deducted from your inventory, and will tell you the reason why. The vaccine brand name was incorrectly selected, the lot number was entered incorrectly, or the patient was not VFC eligible. If you are using an electronic medical record, you'll want to use the VFC Inventory Analysis Helper report. This report will divide up the potential errors in your data from your EMR into those 4 components we spoke about earlier. It'll tell you that the CVX-MVX code is wrong. It'll let you know if the VFC status of the patient was wrong. It will tell you if the brand name of the vaccine was wrong. It'll also tell you if the VFC status of the shot was a non-VFC vaccine. Because sometimes you will have 2 lot numbers that are the same, of the same vaccine, and one is a VFC lot and one is a private vaccine. And then we do have training videos available in eye care. I'll show you where you can find those in a minute. We are updating those training videos, and our goal is to have all of the VFC training videos updated before the launch of the 2016 enrollment period for the VFC program. So if you are new to VFC, you could watch these videos to help you register for the VFC program and how to use eye care. If you are a current VFC provider, you'll be able to use these videos to help you continue having a positive relationship with the VFC program. And the last resource in eye care is the Import tab. Now the Import tab tells us, the administrators, a far greater amount of information than it does providers, but it is a quick snapshot of information, basically how many shots you received and how many shots have been administered by vaccine name and lot number. The patient remind recall function. I know that this meeting was actually set up because of the potential for this to be available. The patient remind recall function is currently available in eye care, but it is not very user-friendly. And so we are working on updating that. We were hoping it was going to be done before this presentation, but it is not yet done. And right now I think the timeline is the beginning of 2016. So hopefully by 2016 we'll have a video available in eye care to help you use the patient remind recall function. But once it is up and going, providers will be able to use eye care to create address labels, form letters, customized form letters, generic letters that we will create send postcards, and be able to create patient lists based off specific criteria. All of those things will be available to providers. Okay, so we have some contact information. Of course, you can use the Contact Us, but here's our direct emails if, for whatever reason you can't get logged into iCare. Again, contact iCare regarding all questions regarding iCare, like logging in, new employees, new clinics, application problems with iCare, inventory issues with iCare. And then you want to contact the VFC program if you have questions regarding the actual vaccines. You can also speak to them about inventory issues, but due to the starting of the 2016 application, as well as continued ordering, they are short-staffed over at the VFC program, so you'll get quicker responses on inventory issues if you contact iCare. Now, if you have questions regarding data transmissions from your EMR to iCare, or your EMR vendor says, who can we contact in iCare, you'll want to contact the HL7 department, and there's their email address. You can also use the Contact Us button and choose HL7 EMR, I believe it is, in the Contact Us button in iCare. Now, if you get your password or get locked out of iCare because of your password expiring, here's the phone number or email address that you will have to use to get your password reset. Us here at iCare cannot see or change passwords, so contacting us will really just delay you from getting your password reset, because we'll just forward you on to this phone number or that email address. iCare passwords expire every 90 days, and you can reset your own password in the web portal application. But if you wait until the 90th day to attempt to reset your password, there is some glitch in the system that will not allow it to take. So you'll be able to log in that one time, but then when you log out, or if iCare goes to sleep, then you won't be able to log back in, and you'll have to call this phone number. And the last contact is the HL7 password support. HL7 accounts, passwords never expire, so as long as you maintain your password, or your EMR vendor maintains that password, you should never have to reset that password. So that's the end of the presentation with the PowerPoint presentation. Does anybody have any questions currently about what we have discussed? I don't see any on. Well, let me scroll down here. Okay. The only question that I see currently is there a way to get a copy of the slide presentation? And that ICAP will make the slides available after the presentation. Also, this presentation is being recorded, and I'm sure at the end of this presentation, Anne will, I assume, send out an email to everybody with how to get the recording of the presentation. Okay. Well, now we're just going to go into then iCare, and I'm just going to show you a few things with the reports as well as other information. This is the home page that everybody will log into. I'm just changing my view so it looks like what you guys see. So every time that you log into iCare, you come to the home page. Now I'm in the development site so that there's no live patient information. But so this looks a little bit different. But the key about the home page is this first tab, which is news and announcements. All of the news or all the news and announcements, just redundant, but a lot of the information that we send out through emails or questions we receive from providers in emails could have been answered by going to the news and announcements in iCare. So, like for example, the recent flu. Flu is always a big thing. We get hundreds and hundreds of emails regarding the flu and when the flu is going to be available and how much of the flu is going to be available, etc. And all of that information was available in the news and announcements in iCare. That's why we really harp on the fact that providers need to be in iCare to make sure that iCare is working correctly, as well as reading these news and announcements. Even if you're using an electronic medical record, you cannot just assume that the data that's being sent is being sent correctly. Also, with the news and announcements, down at the bottom it says View News and Announcement Archive. Every news and announcement that has been in iCare since 2011 is available in here. So if you see it one day and then the next day it's no longer in the view of news and announcements, it's still available for you to find in the news and announcements archive. So, you know, just beware of that. The other tab on the home page that is important is the immunization link. The very first link is the iCare brand name vaccines. These are your CVX MVX code combinations. So you will see that every vaccine name has a CVX MVX code combination. iCare only recognizes the highlighted yellow and red print vaccines. So like for example, we see Rotarix here. We see the CVX code of 119 and SKB as the manufacturer code. So there we go. So so when your EMR sends data to us for Rotarix, it should say 119 SKB. But that link is available in iCare, so you can print this off and send that in to your EMR vendor so that they can make sure that the CVX and MVX codes they are using matches what is in iCare. Also in iCare, you have all of the VFC forms, so you know, temperature log excursions, how to complete the VFC 2016 enrollment form. All of that information is available on this link, tabbed immunization links. Okay. So now we'll want to go into the reports, and I'm going to show you a couple of the reports. So you can get the reports in several different places. On every page in iCare on the left-hand side, there's this key, and there's reports. So you can get to reports that way. You can also, if you're in the vaccines tab, get to reports from the top there. Or if you're in your clinic page, you can get to reports from there as well. So no matter how you go into reports, all three tabs take you to the same place. So in the reports tab, the two reports again that we're going to talk about are the Clinic Immunization Activity Report and the VFC Vaccine Inventory Analysis Report. Again, if you're manually entering directly into iCare, you'll want to use the Clinic Immunization Activity Report, which is under Vaccine Management Reports. It has a red flag next to it, kind of help you find it. And then if we click on it, it's going to give you this search box. At the top should be your clinic. I'm actually just going to change clinic so I can actually get some data. So when you click on that button, your clinic should automatically generate here in the top, and then we can run from the immunizations from however long. If we're going in once a week, then we only need to run it for the last week. If you're only going in once a month, which we do not recommend, you could just run it for a month. I'm actually going to run it for far further back than what you need to, just to get data available. You can search by groups, or you can search by lots. If you enter lot information, this doesn't search by groups. If you enter in group information, then don't enter a lot data in there. We also want to include shots given not from inventory. If, for example, that vaccine lot is now at 0 and you're no longer in stock, but there could be an issue with that inventory, you'll want to include that one. And we always uncheck mark close on print. Because when we click print this report, it doesn't actually physically print the report. It creates an Adobe file. And so if you have closed on print check mark and you close that Adobe file, you'd have to re-enter all this information in. So you don't want to have to keep going back and forth, re-entering the same data over and over again. So that's one thing about reports also, is that you need to have the most up-to-date Adobe Reader on your computers. You'll need to have your pop-up blockers turned off or turned so that they accept anything from the domain illinois.gov, so that you can view and print these reports. So I click on print this report. And luckily this one is blank, which is good for that clinic, but bad for a presentation. But you can see that they're divided up into sections at the top. Has the name of the patient, the date of birth, the date of the shot, the date the shot was transmitted to your EMR. These dates could be different. You could give the shot today, but your EMR doesn't send it till tomorrow. If you are manually entering shots directly into iCare, then these two shots, or these two dates, could be the same. They also could not be the same, because you might give the shot yesterday, and today is the day that you enter in all the shots. The first column that we want to look at is this one that's from stock. This column will just have Y's for yes and N for no's, and we'll want to make sure that all of these are Y's. If there is an N for no, that means that did not deduct from your inventory. And then we're going to use the information to the right to identify the potential reason that shot did not deduct from your inventory. The first one would be to look at the vaccine name. Does it say Gardasil, or does it say HPV unspecified? If it says Gardasil, that's not the problem. If it says HPV unspecified, that's the problem. And then we look at the lot number. Again, we'll want to make sure that we actually have that lot number in our inventory, and that this lot number matches an exact lot number in your iCare inventory. The VFC status is the status of the patient. So if the patient was marked as not eligible, there would be an N here. If it was marked as eligible, there would be a Y here. And then the last column is VFC lot number status. So again, if you had a private and a VFC vaccine with the same lot number, and you accidentally chose the private vaccine, you would have an N in this lot number. Or not lot number, excuse me. You would have an N in this column for VFC lot. So see, when I close that, the search criteria is still available, so I could modify it to see if we could get a report that had some information on it. But we're not going to do that for time. So if you are using an EMR, the report that we recommend is the VFC Vaccine Inventory Analysis Report. That report is actually under the VFC reports and has a red new next to it because it's new to iCare. So again, if we click on that report, we get a similar search criteria. On this one, it has your VFC PIN number. Again, we have the same immunization date on here. If we're doing it weekly, we don't have to do it weekly. I'm trying to see if I can get it to generate some report. Again, you can search by groups or you search by lots. On both of these reports, we do recommend searching by lot numbers. The only reason is because searching by groups could give you a lot of data, which could be overwhelming to go through, as well as all of iCare reports works in the background. And so if there's a lot of web data or web traffic at the time you're trying to run these reports, iCare will run the smaller report first, and the large reports could take longer to run. We're just going to run for all because this isn't a much data in here. Okay, so we did get some data available in this report, and I ran the wrong report. well, at least I know there'll be some. We want to run the helper, or the VFC inventory analysis helper. VFC inventory analysis helper. Okay. Well, at least I know there's going to be some data on this one. Again, we want to uncheck mark close on print, and no data found. Let me try and change clinics here. Okay, unfortunately, it doesn't look like I'm going to be able to run this report with any sort of data because there's no clinics with any data in them. But again, this report, when you run the report, is going to give you the data in those 4 components. So it's going to tell you if the CVX and VX code is incorrect. It'll tell you if the lot number is not correct. It'll also tell you whether or not, report or the transmission has the incorrect administration. The report is that it breaks it down into those 4 components. Start an actual report with data on it. This was for me, but that sometimes. Oh, so the other we want to look is in the vaccines tab. Now, transaction, this shows, it says each transaction that has occurred with that lot number. So if you, I'm just changing the clinic again. All right, I'm just going to have to go back and go into real eye care because there's just no data in this development. I'm sure Sangamon County won't mind if I use them. Okay. Okay. So, well, let's go back to this report and let's see if we can get anything out of it. As I said, by having all of that date, large date range is causing the slowness of this report. Sorry this is taking so long. I'm not for sure why it's taking so long. It does kind of bring me to a good topic about iCare. iCare is a web-based application. So even I am not connected directly into iCare. I have to go through a web server. And so that can cause delays depending on the amount of traffic. And we're doing this at noon when a lot of clinics aren't seeing patients and are entering data or searching data in iCare. Let's see if there's any questions currently. Nope, no questions.
Hi, Matt. I actually am seeing quite a bit of questions. I'm not sure why you're not seeing them. Do you want me to read a few
Sure.
out to you in the
Yeah, that'd be
meantime
great.
while we're waiting for it to load?
Yep.
Okay, sure. So one of the questions.
It
Oh,
just
never
loaded.
mind. Just kidding.
That's all we had to do was talk about it.
Okay.
All right. So at the top of each section, it has what the issue is. Like this one is the bad administered flag. And so what that means is that there are two codes. One is a historical code and one is current code. 00 is current, 01 is historical. And so historical in iCare means something different than historical in typical medical terminology. You know, most people who say historical means in the past. In iCare, historical means not current inventory. This one. And of course, we have bad lot numbers. We have some that are missing lot number, and then we have a lot of those. And then potentially, we have some that have the wrong lot number, and that's the only two errors that they have. But again, these would show up at the top. It would say bad VFC code, which means that the eligibility code was incorrect. And the other one is the bad CVX MVX code error, which then would tell you that here in the directions that the CVX MVX code did not match any in your iCare. The nice thing about this is that you can click directly onto the patient, which is a hyperlink, and you could go into that patient's record to see the potential error. We do recommend making the changes in your EMR and having them resend the data because if you were to go into the patient record and make a correction and then your EMR were to send the same data again, that would override that information. So let me just go through transaction tab real quick and then we can get to the questions since that took entirely too long and it's already 12:40. I want to give plenty of time. And if all of your questions don't get answered today, you can always go into iCare and use the Contact Us button right up here at top and choose iCare and send us the questions there, and we'll be able to answer them. But the Transactions tab is based off of your actual specific lot numbers. So what you'd want to do is choose the vaccine name and choose a lot number. And then you want to include administered shots, and then if you update the shot, it would tell you between this date and this date, 2 vaccines were administered. Okay. If we were to go back further on this date, it would show you that originally you received 150 shots, and then another 20 shots, so 170 total, and then you have administered vaccines. Then you can also see if a patient was merged, like right here. This patient record was merged, so a shot was added back into your inventory. So this kind of gives you a quick view to see. It also shows your waste transactions, if you transfer vaccines from one facility to the other. So this is this is not a good tool to figure out discrepancies, but this is a good tool to kind of get an idea of if there was like an improper waste or the potential for a merged patient duplicating the shots. So let me look, see if and that's all the presentation I have for today. I'm still not seeing the questions, Anne, so if you just want to ask me the questions, I can go ahead and answer those.
Yeah, so one question that we have is, why will I see 1 on some lot numbers that are no longer in stock area that used to be 0, but all of a sudden 1 will pop in there?
Okay. That was the, so here you see the selected view, and then you have the in stock and no longer in stock. Unfortunately, without me going into your clinic and seeing what happened, but typically what happens with a no longer in stock vaccine lot number going back to 1 is because of a merged or changed lot number in the patient record. So initially they received a Gardasil lot ABC, and then later someone went in, or your EMR resent the same shot with a different lot number, so shot ABC now has another shot put back into it. That is the typical reason for that.
Okay, so another question is, regarding returning unused vaccines, VFC never sends the address sticker after we fill all return information in the VFC site.
That is a VFC question. So we do not do anything in eye care with the physical vaccines. So if you did not receive the waste or the return waste shipping label, you would want to contact the VFC program.
Okay. Is it possible for providers to add new employees or update their enrollment form without contacting eye care?
Yes. The keymaster of a clinic can add offline historical users. So your keymaster will have an employees tab, which they can add an employee to the clinic. But that person would not have access to eye care. So this would really be if you are adding a new physician as a vaccinator, the keymaster can do that without contacting eye care. For a new user to actually have access to eye care, you have to contact eye care and complete the individual user agreement and the web portal application to get access to eye care.
Okay, can you explain the PRA?
Sure. The PRA is the Portal Registry Authority. This is a new requirement from DPH Security. Prior to September 1st, only hospitals, health departments, FCHQs, and large organizations were required to have a PRA. But as of September 1st, 2015, DPH Security is requiring all clinics who access any one of the 24 applications through the web portal application must have a PRA. So there is an application, and the application needs to be filled out and sent to DPH Security. DPH Security will approve that person, and then every time a person through your clinic requests access to any one of the 24 applications, the PRA would need to send an email to DPH Security approving that person approving that person's ability to access that application.
Okay, should I move on to the next question, Matt?
Yes. Yes.
Okay, so can you ever start over when accountability is off and you have tried everything to balance it?
Unfortunately, no. Really, that's a VFC issue, but as of right now, they are not allowing anybody to start over. The only thing they are allowing is the payback of vaccines. So if you have vaccines that are unaccounted for, you cannot account for them, you can pay those back through private vaccines, and then, to balance your inventory.
Okay, so is there an easy way to change the number of active patients at our clinic? Say, for example, in the past 5 years, iCare has 32,000 listed as active.
Okay. There are two ways to do that. The first way is in the Patients tab, and then there's this refresh list. So you have criteria where you can, like this first one is include patients who have shots given or reported by this clinic within the past 1 year, 3 years, 5 years, 10 years. So if you click 1 year and you click that button and you click review the changes, again, that's an Adobe report, then you can go through all of those patients and you can mark them as inactive or keep them marked as active. The other way is to actually go into the patient record, and at the top we have change status. And so you can change the status from active, inactive, lost follow-up, moved, permanently inactive, others, unspecified or unknown. So that's the only two ways currently that you can inactivate patients. Once the recall function is activated, then you'll be able to do the same thing as you are able to do with this refreshed list.
Okay, so where can I find the education that VFC 2016 enrollment required?
You'd have to contact the VFC program, but I assume that it is available in this immunization links in the homepage at the bottom. And they may not have put it out yet, but you'll want to, because right here it says VFC Provider Enrollment Policy 2015. So they must not have yet updated for the 2016. But that's a VFC question.
Okay, why does it take so long for records to download from EMRs to iCare?
It takes up to 24 hours for that to occur. And the reason that is because we receive about 1 million shots every day. And so it's, first off, most EMRs are sending what's called a batch file. So they wait till the end of the day, collect all of the vaccines that you administered for that day, and they send it over to us. A lot of times that doesn't happen until 1, 2, 3 o'clock in the morning, and then it's put into a queue. And so iCare processes those shots in the order that they receive them. So it can take up to 24 hours. Now, if you're using bidirectional web services account, that is live data. And so when you create a record in your EMR and save it in your EMR, it should populate in iCare fairly quickly. I can't say exactly how long. It just depends on how much web traffic is there, but that it should be almost instantly because that's live data.
Okay. When searching by lot, is it case sensitive?
No.
Okay. We use iCare to manage both our private and VFC inventory. When we are in our EHR and the vaccine is put into the system as VFC Gardasil and the CVX code 62 is attached to distinguish private from VFC, will the data pull over to iCare and deduct from our inventory, or will there be an issue?
Well, I mean, as long as the data that it sends, you can't change the vaccine name. So if you said like Gardasil-VFC, then iCare won't recognize that. But if you use Gardasil and you use the correct CVX and VX code, you use the correct lot number that matches a lot number in your inventory, and you use the administration code 00 or current, then all of that vaccine should deduct from your inventory.
Okay. If you have run all available reports, reconciled, and you are still off by 1, 2, or 3 vaccines, what do? The rules are to be 100% correct, but how do we get there?
Like I said earlier, if you're unable to account for all of the vaccines, the VFC program will allow you to repay those with private vaccines to get you those balances down to 0, and you'll be able to move on.
Okay. We have noticed problems with inventory when clients are merged. What report do we use to assess whether that happened or not?
Well, it'll be tough to tell because you could run the clinic immunization activity report. That's based off of transactions. Typically, the merging of patients is not going to be the problem with your inventory issues. If you identify a potential patient who was merged and you think that is the issue with your inventory, then you would just go into that patient's record in iCare, go to their shots tab, look at the vaccine in their shot record, and then go to their deleted shots to see if the exact same shot is both in your deleted and their current shot record. That could potentially be the discrepancy.
Okay. We have patients that have bad lot numbers in the report because the patients used to have state insurance and now they do not and have private insurance, but iCare is not updated. I have to go in and correct all of these. Do you know how often this is updated on patients?
I'm not sure I understand the question. iCare is updated continuously. So if they were previously VFC eligible and received a VFC vaccine, that shot should have deducted from your inventory. And then they don't change eligibility on the same day. And it is a requirement of the VFC program for providers to determine the eligibility of the patient prior to the administration of the vaccine. So that really shouldn't be an issue that I can think of. Maybe that person needs to send us a contact us question with a little bit more detail so we can look into it. Because iCare is being updated, every minute.
Okay. Is there an estimated date for when iCare will be able to support a bidirectional interface?
iCare already can accept bidirectional data.
Okay. Is maintenance of iCare always before 5 p.m. and never after regular office hours?
Every Thursday at 4:30 p.m. is the regular maintenance for iCare. If there are, which usually only last at the most 15 minutes. If there is an update or some issue that would take longer than that, they typically do it over the weekend. Sometimes, as other computer programs do, iCare has, to use a lay term, crashed and not been online, but that's not, typical.
Okay. Is it possible for the vaccine to interface the exact same day as it is entered? Because when it's entered, it does not interface until the next day.
If you have bidirectional data transfers from your EMR to iCare, that's the only way that it will update the same day.
Okay. How do I know what lot number is being interchanged with another in my account? I notice sometimes lot numbers in the history are not ones that I used.
Well, that I have no idea because that doesn't really make sense to me. I don't think I understand the question. I mean, the lot numbers you have to use are the lot numbers that are in iCare. Lot numbers don't, iCare, we don't change data in iCare. iCare is a repository. So either you are manually entering vaccine information into iCare, or we are receiving electronic transmissions from your EMR. So what is put in, either manually by you or through your EMR, iCare accepts as correct. We make no changes to that data. So if you entered in a lot number and then later that lot number is different than the lot number you administered, that means either someone from your clinic changed that lot number or your EMR changed that lot number. We don't change that data.
Okay. If the lot number was written wrong in our EMR, 1234 versus 1233, and I corrected in our EMR, do I need to delete the incorrect info in iCare so the shot isn't in there twice?
No. Because the shot did not deduct from your inventory because of the lot number, so iCare sees that as an incomplete shot. So if your EMR is to resend the data of that exact same shot with the correct lot number, it would automatically delete that other shot and just keep the new shot with the correct lot number in there.
Okay. If when you are entering a name, sorry, did you have more, Matt?
Nope.
Oh, okay. If when you are entering a name Liz, but it's really Elizabeth, is there any kind of soundboard like what they have in Cornerstone? It could help duplication. Lots of times entry is done after a patient is gone to make sure of the correct name.
Well, as the VFC program requires providers to check the VFC eligibility of the patient prior to administering the vaccine, the requirement is also to search for patients in iCare prior to putting the data into iCare. If you do not put an exact, iCare is an exact match. So if in iCare it says Elizabeth Smith with the date of birth January 1st, 2015, and you send over Liz Smith, January 1st, 2015, that will create two records in iCare. So really, because the majority of our patients are Medicaid eligible, everybody should be using what is on their Medicaid card exactly for name.
Okay, so it is 1 right now, so I'm just going to do one more question and then we'll wrap it up. And remember that Matt said everyone can email directly to ask iCare questions that weren't answered during the webinar. So the last question is, if we filled out the PRA paperwork and faxed it over, do we get any kind of confirmation that the PRA is approved?
Unfortunately, I don't know the answer to that question because that's actually DPH security. That's not iCare. So, but what I do know is that typically you don't receive an email or any confirmation that the PRA is updated unless you contact security yourself and ask them.
Okay, so thank you, Matt, for presenting on this webinar for us. It was very informative and interesting as usual. So I just want to thank everyone for joining us on today's webinar, and by the end of business day today or early tomorrow morning, everyone will receive an email with a link to today's recorded webinar as well as a PDF of the PowerPoint slides. So once again, thanks to everyone for joining us on today's webinar, and I hope that you all enjoy the rest of your afternoon. Thank you so much.